I am a registered respiratory therapist. I have an extra credential as a critical care specialist as well. The great thing about being a respiratory therapist is there is no typical day. You're going to wake up and whatever shift you work, it is an action-packed adventure every day in a good way. It's very gratifying. You're helping patients. You're delivering breathing medications. You're helping people breathe easier. Really, when it comes down to, when you think about it, it's kind of a cliche, but when you can't breathe, nothing else matters. So it's something that you help someone every day, and you happen to get a paycheck for doing it. So it's a very rewarding career. You help maintain people on breathing machines. You help patients with asthma and all kinds of lung conditions, COPD, chronic pulmonary diseases, and you make a difference in people's lives. The minimal education requirements would be an associate's degree. Reading Area Community College offers that associate's program that prepares you to come out. And what you need is your credential in respiratory care by the National Board for Respiratory Care. The credential that you obtain, that you're seeking, is the registered respiratory therapist. So minimum is the associate's program that brings you into that career market. There are bachelor's degree programs out there as well. Myself, my career path, I obtained my associate's degree, which got me to be employed as a respiratory therapist. And I went on for a bachelor's degree in computer information systems because in respiratory, there's so much technology and we use a lot of software packages, and even the ventilators are essentially computers that operate the machine that helps the person to breathe. I personally went on for my master's in business administration, but getting entry level into the career path. The beauty of this as a field is there's extra specialty credentials. There's a AEC, Asthma Educator Certified. There's a neonatal pediatric specialty exam. There's the adult critical care specialty exam, which I took my position as being in charge of the critical care area. I found it necessary for me to have that. So that's an RRT-ACCS for critical care specialist. We have a multitude of therapists working towards that and some that have that credential in our department. And each of those just gives you generally a little bit more money comes along with the positions that you can obtain by having those credentials. And we have a career ladder here at Reading Hospital specifically, and I think a lot of institutions are modeling towards that. So the more work you want to put into your career, it can kind of make a difference reflected in your earnings as well.
Okay.
Sure. Starting salary range is about $26 an hour. I've had recent graduates who sometimes there are per diem positions, there's full-time positions, there's part-time positions. It's really a career that can work for your life. We are a 24/7 operation, so I can just cite one graduate that I know of in the past 2 years. His first year earnings, because he worked a couple different jobs, he indicated to me he was making over $80,000 a year his first year after being a graduate of RACC's respiratory program. But starting salary is $26 an hour for a fresh graduate. This career is one, like I said, you're helping people breathe. The current situation, people are living longer. There are more pollutants out there. We have a lot of patients with asthma and different lung conditions. And as you know, the coronavirus and different flus are a big thing that bring people that needing respiratory therapy. Respiratory therapists are certainly probably the most educated individual to be able to work with patients with lung conditions at bedside. We work very closely with the pulmonary doctors. In critical care, we work throughout the entire hospital. So a lot of people don't realize we are in the delivery room for all high-risk deliveries. We are in the emergency room. We are in the trauma bay. We are on every medical surgical floor of the hospital. We have inpatient and outpatient services, so our pulmonary function lab, pulmonary rehab to help people condition and get back into life. So it really is a career that has a lot of opportunity and can work for you at different stages of your life. So, you can work weekend options, you can work evening shift, night shift, a combination, day shift. It really is a career that can work for you and change as along your demands in life. It's a career that really gives you a good work-life family balance. This is a career that you are trained, you graduate and you come out and you are prepared specifically to do something. I recommend anybody when they think of a career choice. Number one, go spend time with the people that do that for a living. So job shadow at multiple places with multiple people. You want to make sure that when you spend time in school and studying, that when you're finished, it's a career you actually want to do. And you also want to go into a field that when you come out, you're trained to do something specific. I don't want to be negative on any other field. I'm a very big proponent for this as a profession, because you graduate, and on graduation day, you come out and you're prepared to work in the field that you've studied for. Speaking from my own personal experience, coming out after obtaining my bachelor's degree and my master's degree, you walk out of those doors, you have a piece of paper, and it's like, now what? It's a very open-ended. I would never take education away from somebody, but coming out with post-secondary training that's specific to something unique really makes you proud, and you're going to go obtain a position with something that you were actually trained to do. When I do a lot of interviewing of people that are brand new graduates, and so it's kind of different with a brand new graduate versus somebody that's been seasoned in the field for a number of years. So I'm going to break it down that way. A brand new graduate, what we're looking for is somebody that took their schooling seriously, and really why did you get into becoming a respiratory therapist specifically? Because whatever career path that you choose, it should be something you have a passion for. I don't want somebody that comes in and just says, oh, well, I heard you make good money and I can pick my hours. I want to look at career history. I look for that it's not somebody that really job hopped a whole lot. But with somebody that could be a fresh grad, if they're a more recent high school graduate that went right into school, sometimes their job history is going to be limited, and it is more important on why they wanted to become a respiratory therapist. For somebody that's been in the field longer, I'd ask them, why do you want to come to our institution specifically, or what was your legacy of the past 10 years in the profession? What are you most proud of? What was your accomplishment? So the questions would vary a little bit, but for the sake of somebody coming new into the field, we really look for that you're passionate about helping people. You definitely have to be a people person, because think of when you don't feel well, and we're dealing with a lot of patients who don't feel the very best. Do they want somebody grumpy coming in just to do a task with them or to give them a medication? You want somebody that can engage with them. At the same time, you have to have a personality that respects when somebody doesn't feel well. They don't want somebody coming in talking all about themselves and their day. But sometimes some patients, they want to hear a little bit about what's going on besides their medical condition. So you really have to be a people person, and you have to be able to know how to gauge appropriate conversation with people at different times, depending on how they feel and what they're seeking. My professional advice that I could share with you, I kind of expressed it a little bit earlier. Whatever you have an interest in, go spend time with the people that are doing it for a career. Spend time job shadowing. If you only have 2 hours in a day, set time aside. Call somebody that's in that profession, email them, reach out to whatever organization it is. I know we welcome any respiratory potential student in the future. You can call our department. We set up job shadowing all the time. I bring people in. I'm a very positive person for the profession. I'm a RACC graduate myself. I've been doing this for 25 years. I've elevated to a critical care supervisor over time since 2004, but I held multiple positions, and what I share from my experiences with students and potential students for this career especially is to go job shadow people who have been in the field for a number of years. Spend time, ask whatever organization. If you come here, we try to put you around with a few different people. Some people that are recent grads, some people that have been in the field for a number of years, and we try to take you into the multiple areas. Because like I said, we work throughout the emergency room, the delivery room, the trauma bay, critical care. So I try to, in your experience, also with our outpatient areas, pulmonary function, pulmonary rehab, try to spend enough time for the areas of interest that you have with the people that do the profession every day, and do it at multiple places. The last thing you want to do is take time and you spend a day, your lifelong dream, I'm just going to throw something different. You want to be a veterinarian, and you happen to go to a veterinary office and you shadow somebody for a day, and the first hour you just get the negative vibe. It might be somebody that's been working in the career for 30 years and they're just done with it. You don't want to walk away and have your dreams be smothered by that. Spend some time with the positive people, spend time with, and latch on to them. Any career that you have, latch on to the positive people, but spend time with different people at different levels who have been in the career and different locations. I would say job shadow in this area, if you're looking at Reading's program, you're going to be getting to go around to probably 6, 7 different hospitals in your rotations. You'll acquire the different flavor of what those institutions are. Do the same thing when you're seeking the profession. Visit different hospitals where different respiratory therapists work and shadow them.